County School District is the 8th largest school district in the nation and the 4th largest in the state of Florida. Now, school health services are intended to minimize health barriers to learning for public school students in pre-kindergarten through 12th grade. And joining me to talk about that is Alicia Ford Walker from the Florida Department of Health in Orange County. She's going to talk to us about all of the school, or many of the services school health provides to ensure that our kids stay healthy. Thanks, Alicia, for being with us.
You're welcome.
So let's jump right in. What are the components to school health for kids in Orange County?
Well, in Orange County, we have 3 different components. The first one would be the basic component, which we go in and we do screenings for the children. We check their immunization records. We do some day-to-day health care, and we can help manage any chronic diseases that are going on with the children.
Now, with screening, is that vision, hearing?
With our screenings, we do vision, hearing, BMI, and scoliosis.
Okay, BMI, the
body mass index.
So you're checking for obesity,
Yes,
which we
ma'am.
know is a problem, a growing problem with kids. So that's the first component. What's number 2?
Number 2 is our comprehensive program, and at that point we have a nurse in the school that sees the children day to day. She also does all of the components of the basic program, and then she also does some prevention, pregnancy prevention, counseling, mental health counseling, counseling abused children, and getting in touch with parents when needed.
And the third component?
Our third component is our full service schools. Those schools are staffed with ARNPs, which are advanced practitioner registered nurses.
Okay.
They are able to diagnose and treat the children right on site, so the children do not have to miss school to go to the doctor in order to be treated for any illness that they were suffering from at that point in time.
So this seems like a kind of obvious question, but those are the best ones to ask. In some cases, is this the only health care that some of these children get?
Yes, in some cases it is, unfortunately.
Now, you talked about screenings. What kinds of screenings?
We do vision screening to see if anyone needs glasses, and if they fail, we refer them out to get free glasses. We do hearing, and if they fail, we will send them out to an ENT to make sure that there's nothing structurally wrong, and if they need a hearing aid. We do BMI, where we send the letters home to the parents, letting them know you either fell below the 5th percentile or above the 95th percentile, and we encourage you to see a doctor. And we also have things on there like getting exercise, eating fruits, being healthy. The scoliosis,
which is the curvature
of the spine. We check all 6th graders for that, and if they fail, we refer them out to the doctor. We've caught many cases doing that.
That's fantastic. But it doesn't stop just in the schools. You have neighborhood centers for families.
Yes.
Tell us about that.
There are 13 neighborhood centers for family. We are in 5. We have nurses that are there Monday through Friday, 8 to 5 in 5 centers. They also have schools that are assigned to them, but they give immunizations, they do the screenings, they work with parents, they refer parents out for economic and job placement. Then we also work with seniors out of our neighborhood centers for families, and they just make sure that the kids are well enough to attend school.
Now, you have a big smile when you talk about that, so that one must be close to your heart.
It is. I think it's great because it's a one-stop shop. It's all-encompassing. And so it keeps parents that don't have transportation from catching the bus and driving around all day. So it's great.
Do a lot of people even know those services exist? Because when you say school health, you only think about the time that kids are actually in school. But with the centers, you're talking about grandparents on up.
Yes, they do know. Our centers are very, very busy. I'm sure that we could probably get the word out a little bit more, but our centers are very, very busy.
So for someone who didn't know how comprehensive the care is in Orange County schools, what would you tell them? What's the best part about this program for you?
The best part about the program is keeping the kids healthy so that they can attend school. Unhealthy kids cannot learn. Hungry kids cannot learn. And that is our point, is keep them in school as much as possible.
Well, I thought when you talked about that third component, the kids actually get medicine from a registered nurse if they need it.
If they need it, yes, ma'am.
Do the parents have to give permission?
The parents do have to give permission.
Okay. And have you caught a lot of potentially bad things that could have happened?
Yes, we have. we
Tell
have.
one success story.
A success story is a scoliosis story where we did do a check on a child, and we did find a curve, and the mom was like, well, I was just at the doctor's office, but we did encourage her to go. She went back, and the doctor did agree with us, and he sent us a note of thank you.
Awesome.
So we were very proud about that.
So it works both ways.
It works both ways.
We're glad to hear that.
Yes.
And good for the kids and the families.
It's
Thank you for
awesome.
telling us about that.
Awesome.
To help ensure the provision of safe and appropriate county-level school health services, the Florida Department of Health School Health Program provides funding, technical assistance, and oversight of health services provided in all of Florida's public schools, and that is good news.